Hey guys, Dr. Connor here from Outbound Chiropractic. Thanks for tuning in. Today we're going to be talking about headaches. That's going to be the new topic that we're going to be going over this month. And so in this video specifically, we're going to talk about how headaches are typically treated when you go to the medical doctor. Headaches are super common. Vast majority of everybody will experience a headache at some point in their life. They've done studies that show that 99% of women experience headaches and 93% of men, and even migraines too are fairly common as well. About 25% of women will experience a migraine at some point in their life, as opposed to 8% of men. So these are things that are affecting a lot of people, and they're actually having an effect on not only their health but also their quality of life. So this is something that we want to be sure that we're doing a really good job of treating and making sure that we're getting the results that we're looking for. So what happens when you go to the medical doctor, usually they'll do some sort of physical exam. First they'll start off with a history. They'll learn a little bit more about you, how the frequency, the intensity, the location, what it feels like, that kind of thing. And then they'll move on into some sort of physical exam. That'll include some blood pressure tests, maybe just some orthopedic tests, things like that. And then hopefully they'll do some sort of neurological exam. It doesn't always happen. And since the majority of headaches are something that is, like tension type headaches are the most common, it's usually due to some sort of pain sensitive structure in the body that's getting irritated. So these are things like muscles, especially if it's the case of tension type headache. Even blood vessels can get irritated, or nerves can get irritated. So usually it's one of those three structures that are getting some sort of irritation. It could be chemical, it could be physical. There are lots of different causes or reasons why it's getting irritated. Now, what they'll typically recommend is that there's going to be some sort of lifestyle change that they're going to recommend. It might be getting more sleep, getting the recommended 8 hours of sleep. It could be things like changing your diet, making sure you're not eating a lot of junk food. That can be kind of a chemical stress to the nerve, the muscle, the blood vessel. It can also be something as, they might just recommend make sure you're getting a lot of rest, managing your stress a little bit more. All of those are great. All of those are very important. But then it's the additional thing that they'll almost always recommend is taking some sort of medication. And the medication most often that they'll recommend is NSAIDs. So NSAID stands for non-steroidal anti-inflammatory drug. So these are things like Tylenol, aspirin, Aleve, Bayer, Excedrin. Those are all NSAIDs, and the purpose of the NSAIDs is to reduce the inflammation. So there's something that's causing the inflammation, not really too sure what, and what the NSAIDs will do is they'll reduce the inflammation so that irritation on whatever structure that's getting irritated starts to go down. So really it's focusing on the surface level, okay? That's just the tip of the iceberg, that it covers up the symptom, but it doesn't actually get to the root cause of the issue. They might go so far as to actually giving prescription drugs. If the NSAIDs, over-the-counter drugs don't, or they're not working, they might go so far as doing some prescription drugs. And the thing to be cautious about is that prescription drugs often have some sort of addictive element to it that can kind of get you hooked and you become reliant on the prescription drug, and not to mention the side effects. Prescription drugs, for example, they have been known to cause side effects such as confusion, drowsiness, dizziness, like gastrointestinal discomfort, even causing things like muscle spasm and causing nightmares, things like that. And even the over-the-counter things like the NSAIDs, they can cause things like gastrointestinal discomfort, liver failure, changes in liver function, as well as like peptic ulcers, stomach ulcers, things like that. So you want to be very careful if you do decide to follow through with the doctor's recommendations as far as taking the medication, because they can become habit forming and they're also cause a lot of side effects. So when you go to the medical doctor, that's basically what you can expect the vast majority of the times, okay? Now, here in our office, we have a very unique approach to how we treat patients that come in with headaches and migraines, and we're able to get really good results. And so in the next video, we'll be talking about how we in our office, how we treat and how we analyze and figure out the root cause of what's causing that, instead of just working on the symptoms and covering up basically just the surface level aspect of the headaches or migraines. So be sure to watch next week's video as we'll be going over all of that in detail. And again, thanks for tuning in, and be sure to follow us. If there's anybody that has been wondering how the medical profession treats headaches or migraines, be sure to share this so we can get the word out, and we can more people can be more informed and well educated. So be sure to follow us on Instagram, Facebook, YouTube, and please share this video. Thanks.